My name is Scott Morris. I'm the Executive Director of the Church Health Center. We're in Memphis, Tennessee. The Church Health Center has been around for a little over 22 years. What we do is provide health care for people who work in low-wage jobs who don't have health insurance. First day we were open, we saw 12 patients. We've now taken care of over 70,000 people in Memphis, Tennessee. How it came about is I personally grew up in Atlanta. I was always interested in the church, but the thought of preaching 52 sermons a year sent shivers down my spine. It still does. I don't know how preachers do that. But I read the Bible. I saw this stuff in there about healing the sick. I looked around to see what my church did and realized there wasn't much to it. We had built large hospitals that have church names on them. They do good work, but they had very little to do with worshiping congregations. But actually, the church has always been involved in health care. A third of the Bible has to do with healing the sick. And for the most part, historically, the church has been very good at caring for our bodies as well as our spirits, and then caring for the poor who are sick. So I one day was in the chaplain's office at the Yale Medical School. I looked on his desk and there was a little pamphlet there that said how to start a church-based health clinic. And I go, that's it. That's what I want to do. So I spent the next number of years getting ready for this. I was finally ready to start my version of what that would look like. I didn't want to go back to Atlanta. It had gotten to be too big. I read something somewhere that said that Memphis is the poorest major city in America. And that was what I wanted to do, is come to a city where I could make a difference. So I came to Memphis in 1986, literally not knowing a soul, totally selling out of an empty cart with $12 in my pocket, knocking on doors to say, let's find a way in our community to make a difference, to care for the poor, and to do it under the umbrella of the faith community. So 22 years later, we not only take care of 70,000 people, we have a whole array of programs. We have a $13 million budget that we've raised entirely from this community without looking to the government to be responsible. Our attitude is that either the faith community of Memphis supports what we do, or we have to let the doors close. Well, at that point I was 33 years old. I was too young, too dumb to even have it cross my mind that people would tell me no. And even though I'm older and have more gray hair or less hair, I'm still of the opinion that 100% of the people I ask to help us will volunteer or write a check. And the truth is, most of them do. One of the great things about Memphis is that even though this is a very poor community, if you care about Memphis, if you have a desire to help Memphis, Memphis will embrace you. It's a great thing about this city. Aesthetically, we may not be the most beautiful city in America, but we have amazing hearts in this city, and they certainly have taken me in. I could never imagine leaving Memphis. Did I ever think this is not going to work? The answer is no. I mean, that has truly never crossed my mind. I mean, every now and then, we haven't had an unbroken string of successes. I mean, we've had our own failures at things, but once something doesn't work, it takes me about, literally 30 seconds to forget it. I mean, it's like water off a duck's back. I mean, the same thing's true about praise. I mean, we've been given a lot of awards over the years. I mean, I couldn't tell you what any of them are for the most part, because I basically think that until we have done what we're doing for 30 years, really all we have is a good start. I mean, we've been doing it for 22 years now. We're getting there, but I've got another 8 years before I even feel like I have the chance to step back and look at what the Church Health Center is all about. And one of the problems I have with churches and faith communities in general is that we're incredibly good about starting things. We're terrible about sustaining things. And if you're going to do something, especially for the poor, you can't just raise their hope and then take it away. You've got to be able to look somebody in the eye and with certainty be able to say to them, we are not going away. You can count on us. And I think people would tell you that they can count on the Church Health Center. The wellness component of what we do is built around a passage of scripture from Colossians that says, "You are the children of God, therefore as God's chosen people, holy and dearly beloved, clothe yourself with gentleness, kindness, compassion, humility, and patience, and above all put on love, the harmony which binds all." Now, these virtues, if you will, this is not what you normally hear in the doctor's office. But we believe this is what ultimately makes life worth living. Gentleness, kindness, compassion, humility, patience, love. Life for life's sake doesn't make any sense. Who cares if you live 2 years longer, if it means 2 years longer in a nursing home? Breathing in and breathing out, nobody signed up for doing that. So if what you're doing doesn't bring you more joy, doesn't bring you more love, from our point of view, if it doesn't drive you closer to God, then what's the point? Well, everybody loves the idea of preventive medicine, but it mostly consists of the doctor telling you to stop drinking, stop smoking, lose weight, and get more exercise. It goes in one ear and out the other, and I will tell you the great secret. The doctor doesn't do it either. Now, I think we can do better than that. And for us, the doing better for that is primarily the faith community. We think that's where issues around prevention lives and dies in this country. It doesn't have to be just in the South. It can work anywhere in this country because of the spiritual dimension in life. I'm going to give you an example of that. If I tell a smoker that if they stop smoking, they will live 2 years longer, most smokers think that means 2 years longer without cigarettes. It's not a very great motivator. So if I take away their cigarettes, I've got to replace it with something of equal or greater value. What would that be? Well, for most people, it's only going to be something that enriches their spiritual well-being. So our approach to smoking cessation, we use patches, we use gum, we use every other behavioral modification technique there is, but we also try to engage people in the spiritual life as well. And as a result, we think our numbers are pretty impressive about helping people stop smoking. The same thing's true about the number one healthcare problem in America, which is, no question about it, childhood obesity. We're raising an entire generation of children who go home from school, sit on the couch, play Nintendo, and eat potato chips. An obese child becomes an obese adult who has high blood pressure, diabetes, who can't get a job. I'm convinced it's the number one cause of teenage pregnancy. If you look at the numbers, the largest group of girls who get pregnant are not cheerleaders. They're girls who are obese. Now, why is that? It's because they want to be loved. It's about ultimately a lack of self-worth, a lack of self-esteem, a lack of hope in that child's life. Now, if we don't care about the hope of our children, then what's wrong with us? That ought to be front and center to what we care the most about, especially the faith community. Our attitude of how you become a patient of the Church Health Center, to be a regular patient, a man has to work 30 hours a week. A woman has to work 20 hours a week unless she has children less than 6. But the basic idea is you're willing to do a job that nobody else will do. You will clean out my latrine and you get sick, then we think you ought to go to the front of the line. Congregations that couldn't agree on the price of a cup of coffee are willing to set aside their differences and come together and support this work. Some of the most evangelical, fundamentalist congregations work alongside Temple Israel, Muslim communities, things that would not normally happen, but it happens here. You can make wonderful things happen in your community. Whenever I talk to kids, I tell them, just because you're 12 years old and you think you know what you want to do not let adults, do not let other people tell you it's not possible, that you'll change your mind. We all need to figure out where we're going, and if you are certain you know which direction you want to take, by all means grab a hold of it. Just make sure that God's behind you.